Just before I open with the karakia, we're going to have a new person attending from Enable New Zealand, so I'll give her a short whakatau. And at the end of this meeting, we'll have a short break and ask board members to re-log on for the part 2. Ko tēnei te karakia timatanga. Kia ora timarina, kia whakapapa nau te moana, hei huarahi mā tātou I te rangi nei, aroha atu, aroha mai, tātou ia tātou I ngā wākatai, hui e tai kia. Kia ora tātou. Welcome. It's a bit unusual from this end because we're looking at something that looks like a mailbox, a whole lot of mailbox with people's faces in it. So thank you for coming and welcome. We're just on to our administrative matters. First of all, have we any apologies for today? Tony's apologised. Looks like otherwise we have a full muster. Well, I'll move from the chair that these apologies be accepted. Those in favour say aye.
Maybe we'll go raise
hands. Okay, those against? I declare the motion carried. There are late items, so we'll go into those later, but they're the conflicts of interest, but we'll hold that over till the end, or near the end, which is register of interest. I'll move on to the minutes of the previous meeting. I'll take them as read. Are there any matters arising from the minutes of the previous meeting? I'll give you time to unmute because I know it can be difficult to find that little mute button. Okay. Okay, well, could I have somebody move a motion moving the minutes of the previous meeting, please?
Yeah, I'm happy to move.
Thank you, Vaughan. Do we have a seconder? Karen, thank you. Those in favour say aye.
Aye.
Those against? Oh. Okay. Look, just to save you racing around finding the mute button, which I find difficult to find at times, just raise your hand. Thank you. Okay. I'll sign this in a moment. Okay, well, on to item 3, which is performance reporting. Now this, I've raced ahead of myself now. Yeah.
Did we go to the
Yeah.
Yeah.
So, page 11.
So you're done page 10?
Okay, page 11. Okay, the report from the Cluster Leadership Group, endorsed by Jeff regarding the strategic alignment. I'll take this paper as read. Are there any matters arising? Jeff?
No, happy to field questions. I think rather take it as read. I mean, it's obviously a big focus on COVID, but also looking forward and reporting normal activities. So happy to either myself field questions or the individual authors who are actually attending this on Zoom.
Morena.
Kia ora Matero.
Morena John, morena koutou. I just had some overall questions. One is really about, gosh, there's such a lot of reporting that people are required to do on what seems a very quick cycle. And, you know, I notice, having now had a couple of these reports, that it must be incredibly difficult to get and demonstrate traction on matters. And it just seems like quite a burden. And I wondered if there is the ability at some point to have a discussion about reporting that is more about exception as opposed to this huge amount of reporting that is, but I'm not saying I don't find it interesting or not valuing it. I just think, wow, this is a heavy burden for people when you're trying to do the work, get traction. And I just wondered about the opportunity to, at some time, to have a discussion about exception reporting as opposed to all of the detail that's there. I mean, I notice also, you know, another matter is around, you know, when you look under each of the scorecards of the clusters and the areas where there is, you know, it's reported what the KPI is and so on and so forth. I do obviously notice that there are some areas that require, you know, more attention than others, where the target rate is not being met and hasn't been being met for a time. And I wonder if we, you know, as a board had exception reporting, then we would also be able to give our efforts more specifically to those areas as opposed to all the other wonderful work that's going on. But it is also, yeah, so that's my thought, John, because I see a lot, Māori DNA, you know, Māori ED presentations, you know, and that's also then in the dashboard that's being presented to us later as well. So I just wonder about that.
Kia ora Mātero. I think the challenge in terms of having the information we need at hand, balancing that against what we need to focus our attention on, is always an issue for governance. I think you're talking to how we maintain that balance so that we can actually spend enough time on investigating these issues, but also provide the staff with it without increasing their burden in terms of reporting. My observation of this is really of little relevance at the moment, but I'll speak to this at the end of the meeting. I think you raised an important point. Jenny, yes.
John, thank you. My question pertains to page 17 for Te Uru Whakamauora and the reduction that it states that we've managed to have from some of our older persons into the hospital because of the partnership and the work done during the COVID time. I know that we're going to be talking about learnings and things that we can continue to do later on in another session, but I'm wondering whether that is something that is going to be, that's already identified as going to be continue to be focused on, because if it's indeed deemed a benefit to keep our normal place of residence.
Thank you, Jenny. Andrew, have you? Can you help us there?
Yes, I can. I'll actually let Syed answer that, because the Oprah team was an initiative that he put a lot of effort into. Syed?
Yeah.
Syed?
Good morning, everyone. I mean, the short answer is yes, it is something that we would want to continue. It certainly was appreciated by the ARC facilities, and with regard to what Jenny just mentioned, it seemed for those calls that were received regarding hospital admission, the majority, about 70% of them, were able to be supported in situ without transfer to hospital, which is a good thing all round. The issue that we have is that the CNSs were able to provide that support because they were released from their day job, so to speak. Their usual job is performing community visits on patients who get referred to outpatients, and because we didn't have outpatients, they were able to do this this liaison work with our facilities. So we are exploring ways in which we can relaunch the Opera service, but it's just important that everyone is aware that this was done within existing resource, and now that we're heading towards business as usual, it will make things a little bit tighter.
Thank you, Syed. Yes,
Can I just go back to the observation that Mātero made around the magnitude of the reporting or the volume or the capacity, whichever word we want to use. I'm in support of understanding what we have to record and understanding what is practical to be made available to the board. So just to give a little bit of a picture, with the last board, there was a very, very, very strong desire for a high level of detail. I think would be a fair observation to make. This board, I'm getting the sense, holds a different view, which is suggesting that there is room for us to have a discussion to understand, again, what's practical, but also to understand the backroom work that goes on to deliver this information, and then to understand how is it actually used. It's all right producing it and making it available, but beyond the board, how is this data used to drive our machine? Now, I don't understand that at all well, but I think there is room, so I don't want to lose the observation that you've made, Mataro, there is room to have a meaningful discussion between what governance is looking for and how management use the information. I think once we sort that out, I think we'll get a clearer picture. But it's a good observation.
Okay, well, I'll just quickly cover the...
Karen.
Oh, Karen, sorry, Karen.
Thanks, John. Yeah, my question relates to the Uru Whakamaora cluster as well, and also in terms of the care in the community. I guess the issue that I thought would be good to talk about, I guess, with the restrictions through the stages with the COVID response, and the restrictions, the application of those restrictions to some of our aged residential care providers. I guess there have been concerns raised, and we've seen some of that come through the media from families who have found those restrictions concerning, and particularly around the health and well-being of their family members, in terms of the difficulty of not having that contact. And I'm just wondering, as we go to level 2 and then potentially to level 1, is there any clarity around, and I guess what has been also raised is what's perceived as a little bit of inconsistency of how those restrictions are applied across different aged residential care facilities. And I'm just wondering if there's any clarification that can be given about how those concerns can be managed, and whether there is any adjustments, or what people can expect during that time, because I know that's certainly something that a number of people have raised with me and has been quite prominent in the media.
I will address that first, and happy for any others to kick in. The visiting restrictions for aged residential care facilities are not a DHB judgment. They are made by each facility, and often made by the national owners of each facility. And it's confusing for the public who don't necessarily see that distinction, but DHB visiting policies are for DHB facilities. Aged residential care visiting policies are made by the aged residential care facilities themselves, following a combination of Ministry of Health guidance and their own business policies. So that is where that comes from, and the general flavour has been they have been much more restrictive than hospital or health facilities, with a very good reason, is that that's the most vulnerable population, and it has caused the most tension and the most media stories about the sad state of people not being able to visit their elders. And it is, those are awful stories for all of us to hear, and it's caused a lot of consternation amongst the care workers and amongst DHB staff. But we are constrained by others' rules, if I could put it that way.
Okay, thanks, Jeff. Is there any clarity of going forward about how that might look, or if family members have concerns about the if they perceive that there's an overly restrictive approach, what would be the suggested course of action for them?
Directly with the manager of the aged residential care facility. And if that is part of a national chain, then there are overall chief executives of those chains. So that would be the escalation if people have concerns.
Thank you, that's helpful.
Thank you, Karen. Look, I'll just give time people to reflect on each of these reports. So with Uru Kirikiri Roa, are there any issues arising from there that people would like to talk to? That's on page 19. Looking for hands and can't see any. Tulu Rohi, they'll come up a bit later.
John?
Yes.
Sorry, Aohamai. I'm just saying,
Not at all.
I mean, you know, if we go through all the reports, I mean, if you look at the performance indicators on page 20, as you're going through, I mean, I gather, you know, there are obviously some major issues, and I see that in the narrative about to do with the dental bus, and also there was anticipated an idea over Christmas, but that's a problem because obviously they're not at school. You know, all those things, but nonetheless, look at the Māori, look at the red for Māori. Yeah. So I can see that we are endeavouring to find some solutions, but these are the things that really, surely, you know, I'm just because we're in this report, I'm lifting this example, but that's prevalent throughout most of the clusters, is that the indicators are red a lot for some of the Māori specific KPIs. And so what, you know, unless we spend some time understanding that and giving our focus to it, how will we actually make a demonstrable difference? So I'm just using this one as an example of that. And I see in the narrative the things that are being undertaken, but obviously there's still a number of challenges in that arena. So you know, I'm not sure there's an answer.
Just to add to that, then on page 21, the second paragraph, last sentence, Focus continues to work closely with practices to encourage effective whānau to engage with their practice. I suppose as board, in reinforcing that observation you've made, what I'm really keen to understand is what are the actual actions that it'd be good to see it articulated. Maybe Judith can pick this up when she talks with the team, is what are the specific actions that are going to occur to respond to some of these issues? So I suppose I'm doubling down or adding to the observation that Mathura was making, because quite a number of times through the reports we get the general observation that, you know, we've got to deal with it, but I suppose what the board is saying is how. And there's a general nodding of heads around the room, so I think that's probably as much as a discussion we need to have in that space. But can I just carry that on just for one more section? And Judith, I apologise, I should have got hold of you before the meeting, but it doesn't matter. But in terms of the reports, I know we talked last time around trying to get a consistency around that staff leave thing. And, you know, sometimes it's a percentage, sometimes it's a number. So I'm really keen that we can get that nailed at some point.
Hello, Brendan. It's Judith here. Hello. Can you see me? Can you hear me?
I can see you, Judith. You look fantastic. That age difference is just profound.
Oh, well, it's amazing.
Happy birthday.
Yeah, it's amazing what a few days away can do. Thank you for raising those. I just wanted to raise a couple of points myself. So one of the things we might want to give some consideration to, linked to Mataroa's original point, is each of these individual reports have a large amount of detail, what you may wish to consider is whether going forward you want to continue to see each individual cluster with significant amounts of reporting versus an overall report that where you understand the key areas where we are currently off track and the specific actions as a collective that we are taking to move ourselves back on track. So there may be some readjustment we wish to make in the way that these reports are presented, from large amounts of detail across individual areas to a more collective response. And I just wondered whether that's what you might be getting at, or what the board may wish to consider. So that's one point. The point about the staff annual leave, you're correct. We did discuss that, and then COVID took over. So I apologise.
Yeah.
That simply hasn't been addressed, but it does need to be so it's right report. And I know the clusters have made some considerable efforts despite COVID, to look at their scorecards in the last few weeks. So I hope you're seeing some level of consistency, but we haven't nailed everything completely. So I do apologise for that, and we will be continuing to work on that. But I do wonder whether, while we're working on it, HDAC and the board may want to give some consideration to seeing something that's more whole of organisation rather than each individual cluster. And you've got something similar to that in your board reports when Tracy will present a proposal around a Maori dashboard.
Yeah. I don't want to speak for the rest of the board, but happy to hear you. Sorry, you're the chair. Happy to hear you.
Brendan. I'll wrestle the chair back. Habits of a lifetime.
Have an individual mute button.
No, I'm happy to listen to people. Look, Mataru, I think we do need to discuss this now. This is the HDAC meeting, and I think the point you raised around oral health is one of, I think, two things that really we need to get a handle on as HDAC, simply because that they are point to either a fragile service or an ability to surge or flex up in terms of oral health. But also, COVID hasn't helped us here, but I think the outreach immunisation service also probably needs, we need to know a little bit more about that. Jeff?
Yep.
Yeah. This is page 21.
21. Yeah. You talk about the dental.
Yes.
Yeah. Debbie can probably speak to specifics of what is actually being targeted, but the difficulties you have enunciated clearly. Do you want to deal with that now, rather than already dashboard?
No. I'm sorry, Jeff. I just wanted to ask you for a general background on the effect COVID-19 has had in general on this before I go to the detail.
All right. Okay. Well, I mean, there's been repurposing of a bus to support community testing for COVID. That's one example. I mean, when schools are not in, the kids aren't at school to go and check on. When people are locked in their homes, there's a scaling back, and particularly around ENT activities and dental activities, when in a COVID world, the last thing you want to be doing is going near somebody's mouth or nose. Yeah. So in a very practical way, those things have been scaled back. The problem is when you're not doing so well anyway in that field with dental health or oral health, it means that the missed opportunities are going to be much harder to catch up on. So it's one area where COVID has really compounded an already not good situation. Yeah. I think if I could leave it at that. Thank you.
Deborah?
Kia ora, John, it's Oriana speaking. Can I just add to the kōrero that Mataru brought up? We've going to talk about it later on in the workshop, but in terms of the COVID experience for Māori, and specifically Māori providers and others, there's been a lot of positives in terms of Māori being able to work effectively in the way that we know works for us. And so we're wanting to build on those gains in terms of how we move forward. So we're looking forward to the workshop. But And in that too is, and you'll see in Tracy's report a little bit later on, is that really, and you all know this, is that providers have been working on the smell of an oily rag for a long, long time. And I'm not shy to say that the COVID experience for us as providers and as the Māori community in general has been a huge success in terms of working together and getting unheard of results in terms of supporting the Māori experience as we move through the COVID-19 pandemic. And I'm not sure whether everyone has seen a YouTube clip. Oh, it's not a clip. It's an interview with Sir Mason Jury about the Māori experience during COVID-19 and what has made it successful in terms of the Māori response and protecting that community. So look forward to our workshop later on about this.
Kia ora, Liana. Deborah.
Thanks, John. I think you raised a couple of important points, so it's important for the board to understand that this has been, just acknowledging your observation, it has been a fragile service. We have struggled over the last 15 months. We undertook, so for a bit of history, we undertook a culture review about 8 months ago. We have restructured our leadership for the service, and indeed our dental manager had come on board yesterday, so we're starting to orientate him. He's in 6 weeks as a voluntary member while he's seeing out his resettlement leave as an army member. So he's chosen to come and work for us for 6 weeks during orientation. So end of June he will officially be in charge. So I think that's fantastic. We've got some challenges. COVID has slowed down. So if we think about our enrolments, Mataroa, just to be clear that the COVID impact has reduced our ability to have our enrolments up to date. So that's a specific focus at the moment. So that's why they look so red. We also have struggled in the last year to have full recruitment, but we are starting the year with almost full teams, which is an unheard of for our service. I was just reviewing the risk that's been sitting in Riskman for 7 years yesterday, so that's a long-standing issue. So we're feeling confident as we move forward that with our very strong focus on arrears that we will make inroads. I think just picking up on what Oriana said, Taitoku Oriana, what we've learned through the COVID response and how we've flexed and reached into Māori communities for particularly an example is influenza vaccine, that we can take some learnings for that, both for our dental reach and also for our Māori immunisation. So I think there's a lot of learnings there that we want to gather up and continue forward.
Kia ora, Deborah, thank you.
John, I'd firstly thanks, Deb. That's awesome. I just think I'm building on Oriana's kōrero. I don't think people really, and I'm in no way being disrespectful to people, but actually the extent of the Māori reach during the COVID was something absolutely phenomenal. Even to us as Māori who participate in those communities, we were elated by our ability to connect and to reach in and to increase our reach into our communities. And I think the things like, say this, just using this as an example, or public health nursing, or really what we're saying is that, I'll say it, is that I think it's time that a lot of the resource just came to the iwi and Māori providers to scale up their operations, to be able to reach into their communities. I don't think it's possible for us always to be a conduit for other services to do the same reach that we can. That, I think, is just a reality. And, that is some of the learnings I think that we have had and that we want to take forward. So we're actually thinking that we really want to change it up. Not just a little bit, but a lot. So I'm just building on what Oriana's saying. Unfortunately, I can't make the workshop, so I guess I'm putting forward some of my views now, and I do feel very strongly about that. There is no way that we can continue on with some of the efforts, even how good they've been and how much effort people have made. It still isn't enough. And so with all due respect, it really has to come across to us as Māori to be able to forge forward and make a significant difference. There will be times when we join up, but there are definitely times that we have to take the lead, and we have to be allowed to lead, not just a false sense of reality. Thank you.
Kia ora Mātiro. I think the challenge before this committee and by fact of purpose, the District Health Board, is how we take what we've learned from this. And I'm reluctant to use the word learning, so you can't pluralise a verb, but we seem to be doing that with gay abandon now. But I think the challenge is, and in many of these reports, is how do we take the initiatives being shown by vulnerable populations, and in particular Māori, and I'm not using vulnerable in the medical sense, but in the general sense, because I think, as Jeff observed, is that COVID-19 has shown the fractures in the areas we're dealing with and where we have difficulty reaching. But anyway, look, we're never going to finish this meeting if I carry on like this. Kath.
Thank you. I just wanted to, I was just thinking about what Matiro has been saying, and I think there's a double challenge for us because, yes, we need to build on the successes, but we also need to look at where we've had some for Māori, by Māori services with significant investment. For example, our smoking cessation service, where we've invested significant multi-millions of dollars and we're not making any progress at all. So I think that tells us that we have to be very careful about how we contract, what we contract, and what the outcomes are that we're seeking. And I think Māori providers will be able to tell us, you know, why that's not working and what we could do differently and better. So it does feel like it's quite a complex set of conversations and some thinking that we need to do to ensure that if we're investing differently, we really are investing differently and doing things differently. And just a point that was occurring to me, because we can't take for granted that just providing money to Māori providers is going to be the solution.
Thank you, Catherine. As Chair, look, I'll draw a line under this discussion for now, knowing that we're going to move into the workshop later on today. Kia ora Mātiro and Catherine. But I think the red KPIs indicate that we are not meeting our own expectations, and that's where most of the funding is going at the moment. Okay, well, I don't want to skip over the report, so we'll just go through trying to give people an opportunity to comment. Could you please comment by raising your hand? But we'll go on to Rohi. Have we any questions for Scott? No, okay. To Paharikeke, Karen.
Just unmute myself. John, I should have mentioned at the beginning of the meeting, there are some comments in this report on page 40 around the establishment of the Women's Surgical Unit and changes to the Gynecology Day unit, the Gynecology Day unit, which I'm a staff member of. So I just wanted to acknowledge that overlap or that conflict.
Thank you, Karen. Muriel.
Yes, whoops, I've got me now. Thank you. Just a quick question on about Horowhenua Maternity. I was just wondering if that had reopened yet, because the report states it would reopen when we went to level 2.
Sarah can speak to that. Sarah.
Hey, thank you. Can you hear me okay?
Yeah.
Okay, yes. Thanks Muriel. we decided that we would reopen after 4 weeks in level 2, where we'd showed some consistency. What we didn't want to do was bounce back between being open and being closed, and we didn't quite know what the country was going to do. We knew from the modelling, sort of 9-10 days in, then there could be a spike, so we were waiting to see what happened. And the plan we're looking at now, thinking about how that might happen, but also being mindful of continuing to need a testing centre in Horowhenua, and also needing to continue to operate outpatients and mitigating the clinical risk for that area, really. So we're just working through that as an executive team at the moment.
Okay, thank you. That makes total sense. Thank you very much.
Sarah.
Yes, I'd like to just make a comment on the F rates in here on page 40. There's an uptick in the non-standardised F rate for 0 to 4 for cellulitis for Maori, and that looks quite alarming. I'll just use this as an example. When you dive into the detail, our team went and had a look. You know, we've got a big investment over skin conditions and eczema with a community-led provided service by community child health nurses, and they looked on this and thought, that's not very good, is it? But in diving into there, and firstly, none of these presentations to ED actually resulted in an admission to hospital. Secondly, when you go into the Maori numbers, there were actually 7, only 7, 6 of whom domicile outside our district. So there's no way they could have actually been helped or affected by our skin conditions team. And the one that resided within our district was immediately enrolled in our team. So it just shows that the graph looks alarming, but when you dive into the data, we are actually part of a nation of people who move around, and the programs that we have in place here don't necessarily lead to outcomes that were represented in data as presented.
I guess that would be good then, you know, Jeff, that's a good example of giving some interpretation to the data. Exactly. So, you know, that is the thing about data. So if we were focusing in the reporting on those matters, then that would be great, because we would then go, well, actually, that those 6 children don't domicile here, you know, like, yeah, the interpretation of the data is essential.
Matiro, can I just answer that? So we've only just started doing that piece of work. The information that Jeff's got there is information that's just come out. So we've just heard, so when this report was written, we hadn't got that information. Otherwise it would have been in there. And actually there's a much wider, more detailed piece of work of which the information will come back to board. So sorry, it would have been in there, absolutely, if we'd have known that at the time.
If we had, yeah, we received that information on Friday last week.
Thank you.
From the chair, I have a question for Jeff and Sarah. With a recent public health notice regarding rheumatic fever, what is your sense of that?
Okay, again, this is data from the last 2 days. We have not had an uptick in rheumatic fever. We've looked into all possible admissions. We are steady, and there has been no public health notice to us.
And how's it going with prophylaxis?
I can't answer that question.
Thank you. Any other hands raised? Still at a little distance where my reading glasses don't help. Okay, to Martai Martinga. Any questions for Claire and Deborah, wherever you are? Sorry, Claire. Thank you. Well, no questions for Claire or Deborah. Well done. And to Alato. Lynn and Ruby. Ruby?
No.
Barbara. Sorry. I should really be wearing my reading glasses. All the notes I've taken are almost redundant.
John, could I just ask about the declined referrals, the information sort of on page 50, hang on.
56.
Sorry. Yeah.
56, yeah.
Yeah, 56. Like, really, thank you for the information. I was just, and I noted that there's some overlap in the way that the data is calculated. I saw that. But I was just also noted that there was decline due to capacity, which I guess is a workforce issue, is why that is decline. I can see Lynn nodding. And also, I just wondered, like, what is the, do we know about the ethnicity breakdown of those declined? Does that, have any roll-on effect to then later presentations by Māori? Just looking at the data and thinking about all those things. So, yeah, is that a related matter?
Yes, Lynn.
Look, thank you for that and good morning. Yes, that is a piece of work that we have started, particularly in Uru Arato, is around our referrals and starting to run our waiting list by ethnicity and starting through that work. So that is something we will be looking at in those declines by ethnicity. Yeah.
Thank you, Lynn. Big thumbs up from Matiroa. Karen, sorry, Karen Naylor had her hand up.
Thanks, John. I'm just interested to see the impact of the lower ED presentations on the shorter stays. And whilst it's really good to see that came up a little bit in April, I thought, with the level of reduction of presentations, I kind of was expecting that the shorter stays would be even more improved than that. But is there any context that you can give around that, Lynn, to try and understand how much the number of the presentations that are coming through the door actually impact on how long people end up waiting to be seen?
So in regards to when we were in level 4 in COVID preparedness, and some people would expect that emergency departments did achieve their shorter stays targets over that month, and I don't believe many did across the country. We had to run 2 streams. We had to run red and green emergency departments, and people had to be screened, and people had to move into if they were suspect or had any respiratory illness. So sometimes our flow took a wee bit longer, in and around staff had to wear PPE gear, and we had to work through a process. So some of that potentially in caring for those patients, caring for our staff may have slowed some of that flow down. And for the team too, moving into that model of a red and green and emergency department took some time for them to get there, to work into that model. So sorry, Karen, just part 2 of that question.
It was just really trying to get an understanding, because obviously the presentations, I'm looking at the April numbers, was down by about a bit over 1,000 by the looks of it, about close to a third. Mm-hmm. So the numbers coming in through the door were a lot less. So I would have expected that, with the resource there, that perhaps the percentage of shorter stays has gone up to 82% from 72. So that's good that it went up. I guess I just thought that it might have had more of an improvement or more of an impact on the length of stay that people were having to be in ED as a result of the lower numbers. But you have explained that in terms of some of why things might have been delayed. What are we looking at? I guess we can't predict what May will look like, but I guess the other question is, was there, in response to what you're saying, was there an additional resource to the staffing or to the capability to deal with that additional work in terms of having the red and green and the additional assessment?
So 2 things, yes, there was, and of course we still have our screening pod at the front door of our emergency department to screen patients as they come in and stream them. So there was additional resource given to that, and additional resource into having, particularly through level 4, having a red and green emergency department. One of the others, in talking to the clinical leads, was that the emergency department we had a specific focus on actually patients, trying to turn them round and get them home to the best of our ability during that COVID preparedness. So we probably spent longer with some patients in getting them back home than sometimes we may have admitted them to hospital. And so, yeah, there was a real focus on getting people home and supported. So.
Can I just add to that? There was also a public desire not to come into hospital. I mean, there's a lot of public perception not to do anything. So waiting a bit longer in ED to get back home was seen often as preferable to being admitted to a ward, because the perception that we weren't at a safe place, it was a perception, but it was real. And remember, also we're dealing with people without their family around them because of the limitation of so the whole process inside ED, even though it was staffed up, took longer. So it wasn't uptick, it was good. Was it as much? Not, but there are a lot of compounding reasons.
Okay, thank you, that's helpful.
Just a question from the chair, Lynn. What was, did you notice any of the effect of changes in road traffic accidents and people admitted with alcohol-related injuries?
Oh, certainly. I think across the country, the whole national trauma group across the country, but particularly here, there was literally no trauma, and not just road trauma with accidents, etc. And just in the last few days, of course, those volumes moving to level 2 across the country for not only for ourselves have picked up, particularly presentations into our emergency department and some of the trauma workload into ED.
Is that compounding the additional precautions you have to take in terms of red and green?
We've reduced our red and green significantly. We have now 3 rooms set aside for patients that may have some respiratory illness that we need to flow through. So it has reduced, but there is still, emergency departments still have red and a red area, and we are still screening patients. It's the same for our planned care. Our patients are being phoned and screened in the evening, and then they are screened before they present, as they present to our day of surgery unit as well. So it does slow the process down.
I killed it then. Well, unless there are other questions, I'd like to move some recommendations in terms of the performance reporting. Okay, well, I recommend that the Chair endorses progress made by the services in February, March this year. Oh, Jenny, sorry. Oh, sorry.
No, I was just backing you. I was supporting it.
I'll make the recommendations, then see who will second it, okay? Thank you, Jenny. The second one is note COVID-19 response and commencement of transition planning for each service area. And I think Mateo has spoken to that. Note the impact to operational plans and performance due to the COVID-19 response. And finally, and I think to be noted also, is the innovations in service delivery which are subject to the evaluation of the recovery planning process. Will I move that from the Chair? Will be a seconder? Thank you, Karen. Is there any discussion on this before I put it to the vote? I don't see any hands, and we have Karen as seconder, so those in favour raise your hand. Those against, raise your hand. I declare the motion carried. Thank you very much. We'll now move on to the next part of our agenda, which is Pai Order Paiaki. Tracy.
Oh, morena tātou. Gosh, it's hard to sit here quietly when you're all having conversations about Māori health, I have to say. But thank you for your commitment as a board to wanting to strengthen the way in which we respond to Māori communities. And Matero and Oriana, I just want to thank you on behalf of the operations team for all of the work that you've done over the last 8 weeks in Māori communities. And with the support of Pai Ora Paiaka Whai Ora, it's just been awesome to see all of the iwi come together and the providers to support each and every one of our Māori homes in the district. just going to this report, it seems a little outdated considering that we've been doing so much over this period. But the two things that I just want to highlight is the dashboard that's going to the board this morning. I think one of the considerations should be, while you're having discussions about just tracking and monitoring Māori health, just making sure that we do have the right indicators that we want to be looking at over the next 12 months. We've got a very committed operations executive team and clinical team who want to make sure that we actually get improvement in these areas. And all of that deep diving you've been talking about this morning is absolutely what this dashboard will require of us to do as sponsors of each of these indicators. So there's a big process behind that dashboard, and I think it will depend on how much HDAC and board want to see in terms of that reporting, but we really want to get stuck in as an executive team and make a difference in those spaces. Secondly, a paper went to OLT and Mana Whenua Hauora on where we're at right now with kaupapa service delivery. So I've just written a little bit in there about how we have identified what exactly has been agreed in the way of service delivery to be moved to Paiora for management, in partnership with each of the clusters and enablers. So so we've got a piece of work that's going on right now between Ururohi and Paiora to develop what a partnership agreement might look like, so that we transition well and we don't get the speed wobbles, and so that we are in partnership when working out with our community providers, making sure that we're doing the transition well. We're very clear with the six odd million dollars that we've got going into kaupapa service delivery. On average is doing really well in terms of, from a monitoring perspective, the outcomes that are meant to be achieved as per contract. But clearly we need to dig in and make sure that the areas where we think they could be boosted, we need to have a look at the contract first to make sure that it's actually conducive to what they should be doing and for family needs. And then secondly, we need to ensure that we're clear about the outcomes we're trying to achieve. The reporting, as you probably are already aware of in terms of the way the contracts are established, are all outputs driven. So Craig and I have shook hands and said we need to be developing an outcomes framework by December that will support the organisation to better understand how better off are families by the services that are being delivered to them. The other thing that we've identified through COVID, which isn't new to us because we've been doing it for many odd years, is working across agencies and with Māori and iwi makes a massive difference. So we want to try and capture that learning from COVID in terms of the work that Judith is doing with recovery, ensuring that DHB clearly understands that somehow we've got to get these other government agencies and the NGO sector holding hands on how we better work with our high needs families. I'd really like to see us as an organisation having an explicit pathway and program for how we're going to do that going forward. And of course, we know that resource is challenging, so we're going to have to figure out what that looks like. But on the whole, I take this report as read. I just want to highlight, I need to have a conversation with Kath when she's back on board, but there might be a different way of reporting Māori health going forward versus how we're reporting it now, which is against the Mana Whenua Hauora plan. Kia ora.
Kia ora, Tracy, thank you. In my mind, there are two things that are related. One is Māori health, one is the delivery of services to Māori. One is shaped by what the DHB is able to provide and what the Minister deems important, and the other is what Māori expectations are and those things that enable Māori to access these services. So, thank you. Kia ora.
John, Oriana speaking. Can I just make a couple of comments? One is to support Tracy's kōrero and to pick up on a couple of things, Tracy. Tracy's spoken about better collaboration in terms of working with other agencies. One of the things that we learned through this COVID-19 experience was that actually health needs were not at the top of the pops for whānau. It was all those other things around, heating, safe housing, all those social determinants of health that were actually the things that came to the fore for many of the families. And so that interagency collaboration is absolutely an imperative in terms of addressing Māori health need. And some of you will know that's the Whānau Water Strategic Innovation Development Group is in existence, and that is known affectionately as WASAGE, and that's a very effective forum for making sure that these things happen. And that's been in existence now for a good 8 years, and is absolutely effective. The other thing I just want to say is, Tracy is right, some of this is a little bit redundant because we have moved from there. So you will see when we go to the dashboard and start talking about recovery, that we are a lot more proactive in this space. And so in terms of the Mana Whenua Hauora Board relationship, we're going to see a lot more engagements in that space, and that's a kōrero that we'll have later on as well. So tēnā koe, Tracy.
Kia ora, Oriana. Have we questions for Tracy? Please, Brendan.
So rather than a question, it's a comment, Tracy, to endorse the observations that you've made. I suppose the greatest challenge is how do we ensure that we maintain those crucial agency relationships, and who takes the lead and it's respected. And I simply start for the last, gosh, I don't know, however many years, 20 years in local government, there was that never-ending challenge around which agency was going to be the lead to continue to maintain the relationship. We talk about housing, not worried about health. I think health happens, but Oriana made the comment as well. How do we really nail down actions that tangibly make a difference? Don't have to answer it, obviously, but I do think that's the guts of what we want to achieve. If we've got a suite of unhealthy homes, and we as a DHB would in some respects say, well, that's not our worry, but actually it is. And it's how do we get those other agencies to genuinely partner with us to make that tangible difference? So 100% supportive of the objective, and really looking forward to finding the constructive solutions.
Can I just, thank you, Brendan. Can I just say that, it's a systemic issue. So, so that if you think about an access, there's quite a bit of work that needs to happen if we want to make a massive difference to our population. And you know what? As we go through this process, it won't be just Māori that benefits. It'll be the whole population if we do this right. So if you can think systemically, from a top level, we have mayors, chairs and CEOs making massive differences, who have the control of their organisations to put the resource where they want to or need to. And in line with that, we have a regional intersectoral network that sits, I think that's what it's called, in the district, where we could actually have those guys with a strong agenda, understanding better its population and how we could benefit having people holding hands and delivering to these populations. That's at that level. At the next level, we've got lots of really awesome, innovative organisations coming together collaboratively to work with whānau. So WASAGE, which Oriana spoke about, is one of those. Matiroa, you might want to talk about WASAGE just to let the board know what their job is. But through the layers, there's a requirement for us to identify who these families are that need support. They need wraparound programs related to their aspirational plans and not ours. This is about how whānau see themselves moving forward. Our services need to deliver their services. There's a whole flipping of the way in which a system needs to work now with families to better understand how it is that we need to work with their aspirations. And then thirdly, what I'd say is there's a real job for us to, so here's my learning out of COVID, right? So the first thing that Craig and I did was relax the NGO sector contracts, and that was in line with what was going on nationally. But we made it really clear to our providers, go out there and do what you need to do for the families as you see the need arise. And secondly, don't be so concerned with the way in which you need to report over the next 8 weeks. We've got your backs as a DHB. And what happened? In the first week, we had 1,200 families' needs met. In the second week, we had money pouring in from the Whanau Commissioning Agency to 10 providers, coordinated by Matiroa, to get out there and do the work that they needed to do with each of their listed members. And then thirdly, what we've had is the continuation of really sustained support to these families to keep them at home, to make sure they don't get up to mischief, to ensure they were warm and clothed and fed. And, you know, there's a real learning in that from me, which is, you know, while I seconded Wayne and the team to the work, there was a job for DHB to actually just back off and get out of the way, to allow these people to have the leadership of and the knowledge that they already have to work with these families, to just get on and do the work. And you know what? When you talk to the whānau today out on the street, there's just been a massive difference to these people's lives in the last 8 weeks. How we capture that, we've been talking about that, and Matiroa and Wayne and Chiquita and I are going to get into a room at some point and talk that through, because somehow we need to express this properly so people understand that there was actually a difference made to these families over this time.
Thank you for that.
Sure, Tracy,
it is so, what you're saying is what has happened so quickly, is what the transformation of the disability sector has been trying to achieve, of actually talking to whānau and individuals and finding out what it is that they need from their lived experience perspective. So there's some learnings there too for the disability sector about how your comments about that the bureaucracy needs to back off and let whānau take the lead on what it is that they know that they need. It is so in parallel with what's trying to be achieved in the disability sector right now through the Enabling Good Lives. So thank you for that, Tracy. And I think there's some really, there's some learnings in that for the disability sector too. Exciting.
John, can I just sing, Tracy was saying a few things. I just want to, there are a lot of things going on, and I think Tracy's correct about sometimes agencies need to partner, not necessarily lead. So, you know, Wasage is an example where iwi chair that, not agencies, and the agencies come to the table. And also the DHB comes to that table, and also the DHB participates in a collective impact called Kāinga Whanaora, which is about systemic change, and also did successfully get a budget bid for scaling and repeatability over in Whanganui. So I think there are a lot of things going on that actually now have sort of had maybe more light shone on them. Because of the circumstances that we were in. So we've always, in the whānau sector, that actually is the mantra. We work from the position of what it is that is important to whānau, not what it is that is important to services. And we've been doing that for quite a long time with our engagement process, and how then what are the next steps that are taken in terms of whānau reaching their own aspirations. You know, people don't want to be told what to do. I would suggest that there's no one on this current Zoom that wants to be told what to do. So I'm not sure sometimes why then we think it's okay to tell other people what to do. So, you know, there's quite a shift that is occurring, and I guess some of the solutions are already there, and it's about then how can health, as the DHB, contribute to that, not overtake it, but contribute to it in a way that takes it forward. There's plenty going on. There's no shortage of the road to revitalisation.
Kia ora, Matiroa. I think we have a prelude to this afternoon's meeting, Judith. Kia ora, Matiroa. If there's no further discussion in terms of Tracy's report, I'd like to make a recommendation. But before I do that, this report comes with an indicators report as well, which I hope you've read. Now, it's a living document, and I think we've already seen it develop in the kōrero from Moriana, Matiroa and Heather. But I think we've got to remember, as much as we set up a red and green system at this hospital, and it was very well managed, that it was what Jacinda Ardern, our Prime Minister, calls the team of 5 million, who washed their hands and respected that distance between people, which slowed the virus down. The duty and the responsibility of the DHB was to make sure we had resources should that fail. And what Matiroa, Oriana and Heather are talking about what the community can do to further reduce the demand on services for the DHB that don't necessarily fall within our current mandate. And probably they shouldn't. And I think Matiroa and Oriana have pointed to that, not only with the joint governance role shared with iwi, but also I think the very fact of human nature is that we really don't like to be told things. We were children and we experience that. We don't want to be treated like children in our everyday lives. But look, that's my sermon for today. This is near the end of the our HDAC committee meeting. So I'd like to recommend that the committee endorses Whaiora Paiaka Whaiora Māori Progress Report against the Joint District Health Board and Mana Whenua Hauora Annual Report. Now, we really didn't discuss that much today, but I think a lot of our discussion has been around that and how COVID-19 is going to influence us. But I'll move that from the chair. Do I have a seconder, please? Kia ora, Oriana. Okay, if there's no further discussion, I'll put this motion to the vote. Those in favour, put their hands up. And those against, put your hand up. Okay, I can't see the hands, the motion is carried. Thank you very much. Now, our next part of our agenda is the report from Enable New Zealand on page 66. And we welcome Michelle Lewy. I can't see Michelle. Is there another screen? Wayne, is Michelle with you?
No.
Thank you, Wayne.
Okay, so she's not there.
What shall we do?
So, are you able to make a comment?
Well, I'll take the report as read. I was going to me to Michelle, but she's unable to respond at the moment. So, look, we'll take the report as read, and I'll ask Jeff to make any comments.
Apart from Michelle has been working from afar, and the ability of the Enable team to work from home and continue these services, I think, was impressive, and a lot of planning as they move back into level 2 and beyond. So the team worked incredibly well, and I think I'll leave it at that. But if there are specific questions that board members, or HDAC committee members want to take back, we can note those down and take them to Michelle.
Thank you, Jim. Heather.
I just wanted to ask a question, which Michelle won't be able to answer, but she makes a comment in the report about refurbishment of equipment. Now, it's one of the things that I think it'd be interesting for board members to understand. Enable New Zealand has saved the Ministry of Health and ACC extraordinary amounts of money over the years in their capacity to refurbish and reissue equipment. it's not, the volume of it is noted, but the value of it isn't. And I'm just, every now and again, it'd be interesting to get a report on the savings delivered to Ministry of Health, particularly through the refurbishment and reissue efforts that Enable New Zealand does with many other DHBs as well. So it's significant. It's many, as far as I am aware, if it's as similar to what it used to be, it's many millions of dollars. It used to be over $11 million a year, and it's probably still around there. So it's one of the jewels in the crown of Enable New Zealand, is it's the savings it delivers.
Without putting you on the spot, Scott, are you able to give a ballpark or even stadium park figure?
Last time I looked, it was about 15 million.
Yeah. So that's significant by anybody's estimation, and it's a saving to the DSS budget by refurbishment and reissue. And it would just be nice that board members have that in the back of their mind every now and again.
And just to add to that, that's in the context of an equipment and modifications budget of 45 million. So it basically extends the pie in terms of
Thank you, Scott, and thank you, Heather. Karen.
Thanks, John. I'm just looking at page 69 and the comments around mana whaikaha, and it's good to see that that's extended till the 30th of September, but I'm just wondering if we have any indication at this point about whether or not that will be extended further or continue after the end of September.
We're waiting. My understanding is we're waiting to hear, like a lot of things that have been put on hold, is that 30 September is a holding date, and whether that's going to be pushed out further, we're waiting to hear as the ministry gets back into action.
Okay, so the budget announcements didn't give us any further indication. Thank you.
Kia ora, Matiroa.
Morena. So I was just thinking also on page 69, sort of looking at the volumes by service, and I just wondered what possibility there is to look at Māori in the context of that data, and perhaps there may be some consideration of that contributing to the Māori dashboard, given that Māori are actually high users of Enable services. And so access to the sorts of services being offered there, it would be good to have a look at that data. Be good to ask Michelle about that. Thank you.
Yeah, we can take it to Michelle.
Kia ora, Matiroa. Okay, well, unfortunately, Michelle's not out of reach today. If there are no further questions, I'd like to recommend that the committee endorses Enable New Zealand's report to the 31st of March this year. Do I have a seconder?
Yeah.
Thank you, Heather. Will those in favour raise your hand? Those against? The motion is carried. Okay, well, on to our work programme, page 72. Judith.
Thank you, John. The work programme really is a rather short report. The work programme has obviously been impacted with the changes to your meetings, and also with the agreement of the chair. A number of items were not presented to this meeting, and also the presentations that would have been normally planned have not taken place. So the report just outlines those. It also indicates that in your original reporting plan for this committee, the health and wellbeing plans were due to be reviewed on an annual basis. But I took I took the sort of suggestion that given they were not actually approved until the end of 2019, that you would be comfortable with them being delayed until a later point in the 2020 period, rather than suggest that they were reviewed in the next few weeks, also given the COVID experience. So it really is just a noting paper, but I just wanted to bring those points to the table. Are you on mute now?
I've been talking to myself, yes. What did I say? Okay, how does the group feel about it's the danger of pressing the mute button once too often? How does the committee, the Health and Disability Advisory Committee, feel about delaying the reviews as recommended by Judith? Raise your hand if you agree.
Very comfortable. Very comfortable.
Okay. Okay, you have our support, Judith. Thank you. Okay. The last item of interest is the registration of interest on page 79. Are there any changes to that? Vaughan? Okay. Look, I've just one minor change. I'm no longer a member of the clinical board. Thank you. So,
just a spelling, it's upoko whakarai. And it is tipu, not the same word. Space tipu.
Oh, yeah, okay.
Yeah.
Kia ora tātou. Aside from running through the glossary of acronyms, I think we've come to the end of this meeting. Our next meeting is on the 21st of July. All things going well in our boardroom, face to face.
With a new sound system.
With a new sound system. Well, but look, I'd like to thank you for this. We're going to sign off soon, and the committee will be asked to rejoin. Oh, that's part one. That's part one. So, I'm sorry. Okay, I'm a step ahead of myself. I'll declare part one of the Health and Disability Advisory Committee meeting closed at 10:20.